Welcome to this educational presentation from Professor Mohammadi's Teaching Archives. Today we will discuss counseling and communication pitfalls, common patterns that can unintentionally reduce trust, increase confusion, or weaken the therapeutic relationship. Effective communication is not just a soft skill, it is a clinical skill. It helps patients and families understand the diagnosis, participate in decisions, follow the care plan, and feel respected throughout the encounter. In this presentation, we will move from common pitfalls to practical alternatives, focusing on how to communicate more clearly, listen more deeply, and care more compassionately. Next slide, please. A useful way to think about communication is as a pathway. First, we recognize the pitfall. This may be jargon, interruption, emotional disconnection, rushing, or making assumptions. Second, we understand why it hurts. Poor communication can leave patients confused, unheard, overwhelmed, or mistrustful. Third, we choose a better strategy. This may include plain language, active listening, open-ended questions, checking understanding, and honest reassurance. Finally, we look at what good communication achieves: better understanding, stronger trust, improved recall, shared decision-making, and better follow-up. The 5 C's: connect, clarify, compassion, collaborate, and close help keep every clinical conversation structured and patient-centered. Next slide, please. One of the most common pitfalls is using jargon or overly technical medical language. Medical terminology may feel precise to clinicians, but for patients and families, it can create confusion, anxiety, and distance. When people do not understand what we are saying, they may not ask questions, and they may leave the encounter without a clear understanding of the plan. The better approach is to use plain language whenever possible. When a medical term is necessary, explain it simply and check understanding. For example, instead of only saying febrile seizure, we might say, "This is a seizure that happens in some children when they have a fever." Teach back is especially helpful. We can ask, "Just to make sure I explained it clearly, can you tell me in your own words what we are planning to do?" Next slide, please. Another important pitfall is interrupting or not listening actively. Sometimes clinicians are already preparing the next question or explanation while the patient or parent is still speaking. This can cause important clinical details to be missed, but it can also make the person feel unheard. Active listening means giving full attention. It includes appropriate eye contact, nodding, brief reflections, and allowing pauses. A simple phrase such as "tell me more about that" can open the conversation and help the patient share information that may not emerge from closed questions alone. When patients feel heard, they are more likely to speak openly, share concerns, and provide accurate details that improve clinical reasoning. Next slide, please. A third pitfall is giving too much information at once. Clinicians often want to be complete and thorough, but too much information in one conversation can overwhelm patients and families. When people are anxious, their ability to retain information is limited. The better strategy is to provide information in small chunks. Start with what matters most today. Then pause, check understanding, and continue if needed. For example, instead of giving every possible detail about diagnosis, treatment, prognosis, and follow-up all at once, we can say, "Let us focus first on what this means, then we will talk about what we need to do next." This approach improves recall, supports informed decision-making, and makes the care plan easier to follow. Next slide, please. Another common pitfall is making assumptions. We may unintentionally assume what patients believe, what they understand, what they value, or what they are able to do. These assumptions can lead to miscommunication and may reduce respect for the patient's individual situation. A better approach is to ask open-ended questions and explore the patient's perspective. We might ask, "What worries you most about this diagnosis?" Or "What would be most difficult for your family in following this plan?" These questions help us understand values, culture, health literacy, family resources, and personal goals. When we avoid assumptions, care becomes more individualized, respectful, and truly patient-centered. Next slide, please. Giving false reassurance or overpromising is another important communication pitfall. It is natural to want to reduce anxiety, but guarantees such as "everything will be fine" may damage trust if the outcome is different. Patients and families usually need honesty, but they also need compassion. The better approach is to be realistic and supportive at the same time. For example, instead of saying there is nothing to worry about, we might say, most children do well in this situation, but we will monitor carefully and I will explain what warning signs to watch for. This kind of communication preserves credibility. It allows uncertainty to be acknowledged without leaving the family feeling abandoned. Next slide, please. Poor nonverbal communication can also undermine the clinical encounter. Even when our words are correct, our body language may send another message. Avoided eye contact, closed posture, a rushed tone, or looking repeatedly at the computer can signal disinterest or judgment. Good nonverbal communication includes a calm tone, open posture, appropriate eye contact, and culturally sensitive gestures. The key is to show presence. Patients often notice whether we appear fully engaged before they process the details of our explanation. Respect, empathy, and trust are communicated not only through words, but also through the way we sit, listen, pause, and respond. Next slide, please. Ignoring emotions is a serious communication pitfall. In clinical practice, we often focus on facts, symptoms, diagnosis, investigations, and treatment. But patients and families also bring fear, guilt, anger, grief, or uncertainty into the room. If these emotions are ignored, distress may increase, and adherence may suffer. The better approach is to acknowledge emotions before moving to problem solving. A simple response such as, "I can see this has been very frightening for you," or "It makes sense that you feel worried," can make the conversation more humane and effective. When emotions are recognized, patients feel supported, and the therapeutic partnership becomes stronger. Next slide, please. These key reminders can guide almost every clinical conversation. Listen actively. Allow patients and families to finish and make sure they feel genuinely heard. Show empathy before giving advice. Acknowledging feelings often makes medical information easier to receive. Check understanding by asking patients to explain the plan in their own words. Individualize the conversation by considering culture, health literacy, family context, and personal circumstances. Be honest, but not harsh. Truth should be delivered with compassion and sensitivity. Allow enough time for concerns to emerge, and document communication carefully and respectfully. These reminders are small habits, but together they can transform the quality of care. Next slide, please. The 5 C's provide a simple structure for clear and compassionate communication. First, connect. Build rapport before transferring information. Second, clarify. Make sure the main concern, clinical question, and plan are understood. Third, use compassion. Recognize the person behind the diagnosis. Fourth, collaborate. When there are choices, uncertainty, or values involved, decisions should be made together. Finally, close the conversation clearly. Summarize the plan, check understanding, and arrange follow-up. A well-closed conversation prevents confusion after the patient leaves the room and increases the chance that the plan will be followed. Next slide, please. The central message is simple. Great clinicians treat disease, but exceptional clinicians treat people. Communication is not separate from clinical competence. It is one of the ways clinical competence becomes meaningful to patients and families. Clear explanations reduce confusion. Deep listening builds trust. Compassionate responses support healing. As a final reflection, think about one communication habit you can improve this week. It may be using less jargon, listening longer before interrupting, checking understanding more consistently, naming emotions, or closing each conversation with a clear plan. Better communication leads to better care, and better care leads to better outcomes. Next slide, please. Thank you for watching this presentation from Professor Mohammadi's Teaching Archives. I hope this session has provided practical communication strategies that can be used immediately in clinical encounters with patients and families.